Can't tell that to people. Fibroids are like Rottweilers, right? If you walk past a Rottweiler, if you leave it alone, it will leave you alone. So
Actually, we don't know whether it's the chicken or the egg, Talia.
hi, everybody, and welcome to another episode of ziRight Girls. Here on this podcast, we talk about all things gynae and girly related. We aim to break it down for you into easy, understandable parts so that every woman knows about her gynecological health. I'm your host, Dr. Thalia Isaacs, and I'm here with my co-host.
Hi, I'm Dr. Tembelise Masina. So today we are going to be talking about uterine fibroids. So let's get right into it. So Talia, what are fibroids?
So fibroids, they are generally lumps of benign, non-cancerous muscular tissue that is found in and around the muscle wall of the uterus. They can vary in size, they can vary in location, and they can vary in shape.
Mm-hmm.
So, Lily, what causes fibroids?
So we actually don't know what is the exact cause of fibroids. However, they are quite common. Up to 60% of women may experience fibroids in their lifetime. They are much more commoner in women of color compared to Caucasian and Asian women. So it's a disease of women of reproductive age. So generally, it's your women in the age range between 30 and 45 that experience symptoms from fibroids.
Okay, let's talk about symptoms. What are the common symptoms women complain about when they come to see you that makes you think fibroids?
Okay, so generally a woman can experience heavy menstrual bleeding, so like having to wear multiple pads with clots. Often the periods are prolonged, longer than 7 days. Often they may also experience severe painful periods, and some women may experience like a heaviness or pressure symptoms in their lower abdomen. Very seldom they may have difficulty in passing urine, but generally those are the main issues with fibroids, and they're generally much more commoner in women with infertility. So again, during a workup, you may find fibroids in women with infertility.
Do fibroids cause infertility?
Actually, we don't know whether it's the chicken or the egg, Thalia. They are common in women with infertility. However, we don't know if it is the fibroid that's actually causing infertility, or it is a result of not being able to carry a pregnancy that you resulted in having a fibroid. However, if you have infertility issues or fertility issues, if we are working you up and the only thing that we find to be abnormal is fibroids, then we suggest that it has to be addressed.
Okay. I've also, let's just talk about like fibroids in pregnancy. So they don't always, as you say, they don't always cause infertility if it's found during a workup. Okay, I understand that. But also, fibroids tend to complicate pregnancies. Am I correct?
Oh, yes, definitely. So, again, because fibroids are growths that are within or just outside the womb, because they also are responsive to the reproductive hormones, which are quite high during pregnancy, the fibroids tend to grow during pregnancy. So, how it may affect pregnancy, we've already mentioned that it may impact or have an influence on getting pregnant. Once again, it depends on where the fibroid is sitting on your uterus. It may also cause an issue with implantation, so it may cause a miscarriage. Some women, when they are actually pregnant, it depends where the placenta sits. Sometimes, again, fibroids can cause preterm labor because of competing for space with the baby. And also, it can cause fetal growth restriction or reduced fetal growth during pregnancy.
Okay, so it would be advised then if you have a fibroid to have it addressed before pregnancy.
Ideally, yes. That is why we always recommend that you should try and at least get a preconceptual consultation to just get a general checkup and pick up some of these things before you try to get pregnant.
Okay, excellent.
So how do we treat fibroids?
Literally, I'm a girl of sayings. So, firstly, I always tell my patients fibroids are like Rottweilers, right? If you walk past a Rottweiler, if you leave it alone, it will leave you alone. So, if the fibroid's not bothering you, then you don't bother it, right? We call this in medicine watchful waiting. We know about the fibroid, it's asymptomatic, we'll just keep an eye on it. So, maybe once a year when you come for your general gynae evaluation, have your ultrasound scan done, and we can monitor to make sure that it's not growing or expanding. But essentially, it depends on a number of different factors. The age of the patient. Someone with a fibroid that's discovered for the first time with minimal symptoms at the age of 50 really doesn't need to have major operations or surgical interventions. As you mentioned, it's a disease of reproductive age. Once you go into the menopause, theoretically, the fibroid should shrink down. It depends on location. It depends on fertility desires. So it really depends on a number of different factors. And then there are different interventions which are applicable to different factors.
Okay.
So, age being one of them, someone in her 20s or 30s who's planning a pregnancy in the future may want to have her fibroids addressed, and it can be done either by medical intervention or surgical intervention. And now we also say we have interventionalist strategies or radio interventionist strategies. Under medical, start off with the plain and simple basics. So, as you mentioned, a lot of the times fibroids they cause heavy menstrual bleeding. So we can treat that symptomatically. We can treat just the bleeding during the period. So with that, we give analgesia and we give something to stop the bleeding at the time that it happens. You might want to use contraceptives to try and minimize the bleeding. So while you have your period, try and lessen the amount that you lose at the time of your menses. And then there's also the GNA. I always do this
So what if you want to get pregnant?
in terms of.
So if you have a fibroid and you would like to get pregnant, which would be a better option?
So again, it depends then on location, right? Size and location. If you have a massive fibroid, which is abutting or obliterating the cavity, then surgery is the best, right? Because then you want to remove that fibroid. You want to open up the space that's in the uterine cavity to allow a pregnancy, firstly for sperm to enter the uterus and meet an egg, and then to improve implantation during pregnancy, and also not to have the baby compete for space with the fibroid, which may result in a miscarriage. So then surgery would be the best option for that particular patient. And there's different, what do you call it, strategies that can be employed to address that fibroid.
Okay. And tell me a little bit more about the non-surgical options of treating fibroids.
Okay, so besides the medical ones that we've spoken about before, we have now what we call interventionalist medicine. So there's something called a uterine artery embolization. So this is where they put a catheter in the groin of the female and they feed it to the blood vessel supplying the fibroid. And the idea is that if you cut off the blood supply to the fibroid, over a period of time, it will die off, degenerate, and shrink down. It is tricky in somebody who wants to have children because the blood supply in the genital organs, the uterus, and the ovaries sort of share common blood supply. So theoretically, again, it's thought that if we cut off blood supplies to parts of the uterus and the fibroid, you might cut off blood supply to the ovaries. We have something else called HIFU, which I had done on my neck last week, which is quite painful.
Can't tell that to people. Not more than surgery.
Not more than surgery.
Not more than surgery.
Okay, so
Okay,
then
HIFU. Tell us more about HIFU. That sounds interesting.
So HIFU is ultrasound, which is directed right at the fibroid. Let me say that it's quite uncomfortable. Yeah, I had it done on my neck 2 weeks ago. It is uncomfortable. It causes some discomfort, a little bit of pain, but yeah, like I took 2 Panados and I was fine thereafter. So that's also an option, which is non-surgical and interventional. It does require time, right? So you can't have your HIFU done today and tomorrow be fibroid free. So you need to have time. And there's things that one needs to consider both with HIFU and uterine artery embolization. So you mentioned like pressure symptoms. If you have a massive fibroid that's like sitting on your bladder that's causing incontinence, that might not be the first option that you want to consider, because like I said, it takes time for the fibroid to shrink down. So if that's your main symptom, you're not going to have relief of that the very next day. Fibroids also tend to press on other structures. So like you can get clots in your legs from the blood supply in your legs being compressed by the fibroid. They can cause kidney problems if they're pressing on the ureters, or like the systems between the kidneys and the bladder. There you wouldn't want to consider something that's going to take a long time if your kidney is being compromised. But it is a nice, less painful option than surgery, or a less invasive option other than surgery to consider if you're not like pressed for time. Those are the other two options that you can use. Tell us about surgery.
Okay, so surgery again, you can either choose to remove the fibroids. Again, like you said, it depends on your age and fertility desires. So for younger women, who still desire to have children, ideally you would have to remove the fibroids. There's different ways which you can obviously access the fibroid. You can do it by open myomectomy, you can do it laparoscopically, and again, depending on where it is, if it's just right under the endometrial cavity, it can actually be done hysteroscopically. So with advancing medicine, now we can do a lot of treatment options minimally invasive. Then if you are more than beyond your reproductive age and you're still experiencing heavy bleeding, pressure symptoms, and you have tried medical interventions and they are not working, again, because yes, although fibroids are slow growing growths, they do tend to recur, so meaning they can come back. It would still be advisable then that you can actually remove your uterus. So those are the two main surgical interventions for fibroids.
Okay. So just as a summary, let's just like bring it down to a capsule. Fibroids can be managed by doing absolutely nothing and just
Yes.
regularly having a checkup, make sure that they're not expanding or worsening. You can use medical treatments, which might be as simple as taking some Brufen and something to stop the bleeding.
Yes.
You may want to use hormonal therapies like a contraceptive to try and lessen the symptoms. However, this is not going to remove or treat your fibroid. There are some hormonal analogs that can shrink
Other
them down.
hormonal drugs, basically.
Yeah.
There's various kinds
Yes.
that can stop the symptoms or improve the symptoms.
And then you can use interventional medicine like uterine artery embolization or HIFU.
So, like your radiological interventions, which is your ultrasound and your intervention radiology.
Yes. And in Cape Town, we now have radio ablation as well. It's very new. I think only 1 or 2 hospitals in Cape Town offer it. And then surgery, which can be minimally invasive. So when we say minimally invasive, we're talking about laparoscopy, which is the keyhole surgery we spoke about in our endometriosis episode, or hysteroscopically, which means the camera goes in through the vagina, cervix, and in the uterus. Or it could be an open surgery, and it could be to remove just the fibroids or the entire uterus.
Yes.
Okay.
All right. Thank you for that nice summary of the treatment options.
So I really like what you said about preconceptual visits to your gynae, how these things are picked up then. I do think it's really important that people see their gynaes regularly so that these advices can be given to them, especially when you're planning a pregnancy. So many times we see in pregnancies complications, and you wish, like, as the gynecologist sitting with your patients, like, if I had only just known 3 months or 6 months ago, like, so I really think it's important. That's a really good message and point that you made there, Litle.
That's true, Talia. So I think people must also think about their gynae visit like their dentist visit. You don't only go to your dentist when you have a painful tooth. You just go for regular cleaning, screening for cavities, whatever advice that your dentist can give you. So same with gynae problems or gynecological health. You just go for a routine checkup. If there are problems, then they can be solved before they become bigger problems. So, I hope you guys enjoyed today's episode, and remember, if your periods are heavy with clots, they are more painful, consider that you may have uterine fibroids. And remember that not all fibroids need to be operated on. Talia?
Also, if you are planning a pregnancy anytime in the future, it may be wise to have a gynae consult just before that to make sure that everything is okay and that you don't have things like fibroids that may have an impact on your pregnancy.
And remember, fibroids are not a cancer. So I hope you've enjoyed today's episode, and we hope
ziRight.
What's